Having trouble or pain in your feet. People who have diabetes may notice this as the start of a major problem. Foot ulcers. People with diabetes often have problems like poor circulation and high blood sugar, which lead to these painful sores. Ulcers usually show up under the big toes or on the balls of the feet. They can expose deeper layers of tissue and even reach the bones, which is very dangerous. Even though everyone with diabetes is at risk, these risks can be greatly reduced by taking good care of your feet and managing your condition properly through food, exercise, and insulin treatment. Different types of treatments are available for diabetic foot sores, depending on what caused them. In this video, we will explore 6 diabetic foot ulcers and how to treat them properly. Number 6. Skin discoloration. Changes in the color of your foot, like going red, blue, or even black, are very bad signs. These changes usually mean that your circulation is bad, which is a common problem in people with diabetes. Tissues that don't get enough oxygen and nutrients can become more likely to get hurt or develop ulcers when blood flow is low. This kind of darkening should be seen as a possible early warning sign of ulcers that need to be checked out and treated right away. Number 5. Swelling. You should also pay attention to swelling in your feet and legs. It often happens when there is an infection or swelling, possibly because of an injury below. The growth could be from fluid building up as your body fights off the infection, or it could be from damaged tissue that is inflamed. If you know how to spot and treat swelling, you can keep diabetic foot ulcers from getting worse. Number 4. Increased temperature. If you feel that some parts of your foot are warmer than normal, this could mean that you have an infection that is still spreading. When you have an infection, more blood flows to the area, which makes it warmer. If you compare how warm one foot is to the other, you can tell if the temperatures are different. Number 3. Foul smell. If a wound on your foot smells bad, it's likely that you have a bacterial illness. It's important to be worried about this symptom because it often means the infection is serious and might be spreading. If you notice a bad smell coming from a foot ulcer, you need to see a doctor right away to avoid more problems, like sepsis or deeper tissue damage. Number 2. Oozing fluid. And when pus or clear fluid comes out of a cut, it is clear that the wound is infected. This discharge is your body's way of fighting off an illness by releasing white blood cells and other substances that are meant to kill the bacteria. The oozing shows that there is an infection and that the body is trying to fix itself. On the other hand, constant discharge without healing can make situations worse. Number 1. Pain or numbness. People with diabetes may not realize they have pain or weakness in their feet because diabetic neuropathy can make it hard to feel. You might expect to feel numb, but you shouldn't ignore any pain or stiffness that gets worse. These signs could mean that you have a serious illness or nerve damage below the skin. The fact that you can feel either pain or numbness means that you need to be carefully watched and treated to get rid of the underlying reason. If you are facing foot problems and want to know all the foot problems of diabetics, then go to the link in the description and watch our complete video. Causes of diabetic foot ulcers. Most of the time, poor circulation, high blood sugar, hyperglycemia, nerve damage, and sore or hurt feet are to blame for diabetic foot ulcers in people like you. Poor circulation is a type of vascular disease that makes it hard for blood to get to your feet. This can also make it harder for sores to heal. Managing blood sugar is important because high glucose levels can make it take longer for an infected foot sore to heal. It might be harder to fight off infections from ulcers if you have type 2 diabetes and other health problems. Nerve damage that lasts for a long time can make your feet lose their feeling. Nerve damage can make you feel tingly and pain. This damage makes you less sensitive to foot pain, which can lead to cuts that don't hurt and can turn into ulcers. Ulcers can be identified by drainage from the area and sometimes by a lump that you can feel but that isn't always painful. Risk factors for diabetic foot ulcer. People with diabetes are always at risk of getting foot sores, which can be caused by a number of different things. However, there are some things that can make your risk higher. Foot ulcers are more likely to happen if you wear shoes that don't fit well or aren't of good quality, if you don't wash and dry your feet properly, and if you don't cut your toes properly. Your risk is also higher if you drink alcohol, smoke, which slows blood flow, have diabetes-related eye disease, heart disease, kidney disease, or are overweight. Taking care of these risk factors is important if you want to keep foot ulcers from happening. Medications for foot ulcer. Your doctor may give you antibiotics, antiplatelets, or anti-clotting medications if your ulcer gets worse despite preventative or anti-pressure treatments. A lot of the antibiotics that are used go after Staphylococcus aureus or SS hemolytic streptococcus, which are bacteria that cause staph infections or are usually found in your gut. You should tell your doctor about any other health problems you have, like HIV or liver problems, because they can make you more likely to get these harmful bugs. How to prevent foot problems. A 2017 study in the New England Journal of Medicine found that more than half of diabetic foot ulcers become infected, which can lead to amputation in about 20% of moderate to severe cases. This makes preventing foot problems very important. It is very important to closely watch your blood sugar because steady blood sugar levels greatly lower your risk of diabetes complications. And to protect your feet even more, wash them every day. Make sure your fingernails are trimmed correctly without cutting them too short. Keep your feet dry and moisturized. Change your socks often. Get corns and calluses removed by a podiatrist. And wear shoes that fit well. Diabetes, foot ulcers are a serious problem that can happen because of poor circulation, high blood sugar, nerve damage, or hurting your foot. They make the risks of infection and surgery much higher. These risks can be greatly reduced by keeping an eye on blood sugar levels and taking care of your feet by washing them every day, cutting your toenails properly, and wearing shoes that fit well. Skin discoloration, swelling, increased warmth, bad smells, fluid release, and changes in pain or sensation levels are all things that you should be aware of because they could be signs of ulcers. If you notice any of these symptoms, you should see a doctor right away to avoid more problems. Remember that keeping your diabetes under control and taking good care of your feet can help you avoid getting foot sores. Don't forget to subscribe, share, and leave a comment below to get more information and advice on how to effectively handle diabetes.